Welcome to Out Milwaukee, the show where we focus on issues in the LGBT community and the resources that are available to them. On top of providing you with plenty of facts, today we'll be talking about HIV, a disease that made headlines in the 1980s and resulted in a worldwide campaign of knowledge and prevention. A lesser publicized issue that is needing more attention: gay homeless youth. We'll visit Richard's Place in Waukesha, an HIV/AIDS housing center and hospice for people living with HIV or AIDS that has been providing care for over a decade. And we'll sit down with Tess Gallen, a documentary filmmaker and UWM instructor that made a documentary about the rising number of gay youth that are homeless for various reasons. Though by no means an LGBT disease, LGBT, of course, standing for lesbian, gay, bisexual, and transgender, HIV is mainly associated with gay men because of the outbreak of the then unknown disease in the 80s. But before we go further, we should talk about what exactly HIV/AIDS is. HIV stands for Human Immunodeficiency Virus, whereas AIDS is Acquired Immune Deficiency Syndrome. HIV is a virus that attacks key points of the immune system, your T cells or your CD4 cells. Your CD4 cells are the main fighters of infection in your body. They tell your body when there are intruders that they need to fight. Since HIV attacks these cells, your body becomes less able to fight sickness. When the HIV destroys enough CD4 cells, the disease can turn into AIDS. It's important to watch your CD4 counts as well as your viral load. The viral load measures the active amount of HIV in the bloodstream. The beginnings of HIV are still relatively unknown, but according to scientists, they believe that the disease was first transferred into humans sometime between 1884 and 1924. It's believed that in 1961, the disease made its way from Africa over to Haiti before coming to the United States around 1970. Once it was in the U.S., doctors and researchers were still unaware of the growing epidemic until the signs started coming in 1981 in California and New York among gay men. At first, doctors didn't know what to make of this disease, thinking it was a form of Kaposi's sarcoma, a relatively benign cancer which usually was found in older people, though they were finding much more aggressive forms of this in young gay men in New York, which seemed to baffle doctors. In September of 1982, the term AIDS first made its appearance at a meeting in Washington, D.C., replacing the previous terms GRID, gay-related immune deficiency, AID, acquired immune deficiency, community-acquired immune deficiency, or some even called it gay cancer. This change occurred when more cases emerged that were in heterosexuals and children given it through birth. By the end of 1983, 28 countries worldwide had reported cases of AIDS. By 1985, the fear of catching AIDS had spread and discrimination began, as the real causes of getting AIDS was still quite vague. It wasn't until 1986 that AIDS was split into HIV and AIDS. While we're on the topic of getting HIV/AIDS, let's talk about how you can and can't get the disease. The disease is passed through certain bodily fluids, either through unprotected sex or through sharing needles in injection drug use. These fluids have a high enough concentration of the disease to be transmitted. Now, almost as important as knowing how you can get it is knowing how you can't get it. Of these bodily fluids, do not carry enough of the disease to infect you, unless, of course, there is a blood in any of them and you have significant contact with them. Though HIV is currently an incurable disease, the medications available today have improved so much that you can live your whole life with the disease without it turning into AIDS, so long as you adhere to your medication regimen. Now, before we go to our piece on Richard's Place, we'll leave you with an interesting question about HIV. Now, how many people living with HIV are unaware that they are carrying the disease? Is it 13%, 19%, 21%, or 34%? Stay tuned and we'll reveal the answer after this. Let's take a look.
After losing a really good friend of mine in the mid-90s that had HIV and ended up passing away in 1995, I decided then, and actually a little bit before then, I'd been thinking about wanting to open a house and provide a place that people could live in a home environment and get support and acceptance and anything needed to be able to be comfortable. What Richard's Place does provide mainly is housing and 24-hour staff or supportive staff in both the homes that we have. And but we provide, everything that anyone needs in the home with the food. And the biggest thing is probably medication monitoring and making sure that people are taking the medication the way that they're supposed to and getting to medical appointments. Then anybody that's needing to get kind of hooked up with benefits, whether it be Social Security or whatever kind of benefits they might qualify for, our caseworker will help with getting that taken care of.
Some of the residents also provide care, giving back to the place that helped them.
I'm a resident assistant. I talk to the residents, clean rooms, pass out medications, cook, clean the house up, watch programs with the residents, and just have a great, wonderful time.
For over a decade, Richard's Place has been providing these important services to the community.
I think it's important because there are so many people living with HIV that are homeless or in situations that are not an environment that is helping them with being able to improve their health. Medication adherence is a really big problem for people living with HIV, and so having the help and the education and getting to understand a little bit more why it's important to take medication the way that they're supposed to and eat well and have healthy meals. And one of the things we try to address is, living a drug-free or alcohol-free life if somebody has issues with addiction. And we're able to kind of see and help somebody who maybe also has some mental health issues that maybe needs to get kind of referred to a doctor and kind of get that treated as well. Certainly having an environment that is alcohol and drug-free and provide some education as well as just the kind of companionship is really important for people.
That companionship, on top of the other services they provide, has had profound effects on the residents.
As far as my quality of life, I mean, there's the staff there that just cares about us so much, and there's not a big turnover of staff. All our staff members have been there from anywhere from 2 to 6, 7 years. You know, we have one gentleman that's been there with us for 15 years. You know, so my quality of life has just improved. I'm personally stronger, you know, because they help me deal with myself.
It has turned my life around completely from not being responsible to being responsible to being a man, not a boy. It has showed me to love unconditionally, and I love this place.
Now, my blood work is great. My CD4 is higher. My viral load is undetectable. They've just, I mean, like I said, I mean, Corey again is just so amazing. You know, and she cares so much for us that, I mean, it's great. You know.
This still is a very misunderstood disease, and support and understanding seem to be the main services the public can provide.
There's still some of the stigma and thought that because of what, you know, it's HIV, or that people bring it on themselves, and that still is something that really needs to, I hope, someday be addressed, or people will learn a little bit more about, so that there's more understanding and support for people that are living with HIV.
I guess all in all, it's just that Corey knows what she's doing, and you know, she's worrying about funding right now and stuff like that. And I mean, I just feel that there's people out there that could and will help us, you know. And I hope that a lot of the stigma of being gay and everything isn't causing any problems or anything, because right now it is a manageable disease, just like diabetes or, you know, some other things. But I'm real happy there. I'm really happy there.
So, how many people living with HIV don't know they're infected? Was it 13%, 19%, 21%, or 34%? 21% of people living with HIV don't even know they are carrying the disease. That statistic just shows how important it is that you go out and get tested. You can go to your doctor, or many women's centers offer the test, which is very inexpensive and takes less than a half hour. Lots of schools and organizations also offer free testing as well. For more information on Richard's Place, you can visit richardsplace.org, or for info on HIV/AIDS, you can go to the AIDS Resource Center of Wisconsin at arcw.org. Now, homeless youth is an issue in itself, but the problem of LGBT homeless youth is a rising concern considering the fact that 10% of humans are LGBT. The fact that the number of homeless LGBT youth shoots up to 25% is a problem. Why is that number so high? There seems to be a few different reasons that stand out above others. The main reason seems to be family issues. Parents not accepting their own children for being LGBT, either for religious reasons or otherwise, and kicking them out if they do not change who they are is the main reason. Running away from abuse is the second most common reason. Speaking of abuse, LGBT youth are twice as likely to experience sexual abuse before the age of 12. Once homeless, LGBT youth are at a higher risk for victimization, mental health problems, and unsafe sexual practices. According to studies on homeless youth, 58.7% of LGBT homeless youth have been sexually victimized, compared to 33.4% of heterosexual homeless youth, and are 7.4 times more likely to experience acts of sexual violence than heterosexual homeless youth. This can come from having to trade sexual favors for a place to sleep to getting something to eat. Now, there are a variety of organizations that deal with LGBT homeless youth and providing housing and counseling to those in need. We sat down with Tess Gallen, who made a documentary about this issue and followed 5 homeless youth that were involved with a few of these organizations. Before we go to the interview, we've got another question that will be answered after the interview. Compared to the 29% of heterosexual homeless youth that commit suicide, what percentage of LGBT homeless youth commit suicide? Is it 35%, 49%, 54%, or 62%? We'll show you the answer after this.
So, what is Out of Respect?
Out of Respect is a documentary I worked on in collaboration with some UW-Milwaukee students. It follows 5 homeless LGBT youth for about a year of their lives. It's feature length, and and it's turned out to be a really neat way to show the face of this population. You can read about it in statistics, you can hear about what life is like for, you know, homeless gay kids, but when you actually meet 5 and follow them, you care about them. You know, so it's putting a face to a really important topic that more people need to know about.
So then how did the documentary take shape? I mean, did something happen that made you want to cover this?
It came about a couple of ways. The original concept came to me from Jane Otto. She showed up at my doorstep here at UWM about 5 years ago, looking to do a story on a young man who just aged out. He just turned 18, had nowhere to go, had been shuffled after getting kicked out of his home. He was shuffled from different group homes, and it's a real common problem for kids once they hit 18. If they haven't had the good resources and support, they're left with nothing by the time the system's done with them. And so she wanted to do a documentary to kind of show that plight, and she and I searched for money together, and we weren't able to be successful with finding any. And so I just told her, Jane, I'm going to do this. I believe in this story. I'll find the money as we go, and we'll save some money by doing it through the university and saving resources that way. But the more research I did, the more I realized we needed to tell a bigger story. It's not just gay kids aging out of foster care, it's also getting kicked out of their home and exchanging sex for a place to sleep, living in abandoned buildings, getting back into maybe their adoptive families and continually being abused on multiple levels. And so the story got more diverse in this respect of all the different experiences for gay kids who have either aged out or are homeless. And I also did it because when I came out in my early 30s, I came out to a very respectful family, and obviously at an age where I can't get kicked out of the house anymore, but it was an easier experience for me, more positive. And so I have a strong passion for young people who come out at earlier ages and what they're facing with either their families or society who's not quite ready for it. So a couple of reasons there.
Was it your intention to work with Q Block, or did it come about while you were shooting?
What happened was I first wanted to find young people willing to be part of this story, and that was a challenge in itself to find 5 people willing to be out, and then also homeless people. You know, it's being transient, it's hard to keep track of them. And so I was fortunate to have found 4 of the 5 were actually just getting started in Q Block, which is a program that was giving them safe housing options. And so by them checking in with Q Block, you know, whether it was once a week or once a month, I had that consistent resource where I could go to and say, hey, have you heard from Josh, or has he checked in, and kind of keep track of them that way. So it just happened that 4 of the 5 were all taking part in becoming new participants in the Q Block program. And then one other, Amber, was working with St. Emilion Lakeside to get some housing. So that's how we kind of got introduced to Q Block. And so then as part of telling their story, I followed them through that process of what it's like to be working with this agency, and kind of the highs and lows of all of a sudden being responsible and needing to try and find rent money, and, you know, be able to afford food, and whether they're going to get a job or they're going to go back to school. And so it kind of was a perfect way to sort of show what it was like for these young people who happened to be gaining access to a resource, rather than following 5 young people who were sort of not getting any resources at all. So.
In the documentary, you define a lot of words that are relevant to the subjects. Could you tell us what a throwaway is?
A throwaway is a young person who basically has been thrown out of the home and not given the opportunity to come back. What we found as we were talking to a lot of these young people is that they had to make the choice to be gay or straight. And if they decided they were going to stay gay, then some of the parents couldn't live with that. A lot of it had to do with religion. In their mind, their child would go to hell, and that's condemning their child to hell, so it would be better to lose their child than to send them health. So, but there were also other reasons that parents threw kids away that didn't have to do with religion. It's just they just a strong belief in not being okay with their sexuality, and so it's very different from running away. There were many young people running away from abuse at home because of their sexuality, versus they were thrown out and said, "Don't ever come back."
So were all the people that you followed throwaways then?
Combination. Definitely Josiah was a throwaway for religious reasons. But several others actually have gone back to their adoptive families or their biological families, but they were either kicked out for their sexuality, or parents had a hard time, couldn't afford to pay for them,
right?
Or there were drug reasons or different types of abuse. So they were, a few of those were runaways for those reasons.
So what would you say is the most profound thing that you learned when you were making this documentary?
In the end, what humbled me the most, being part of this documentary, two things, was the strength and courage that these young people embodied. We tend to label people when they're homeless as victims. They were like the furthest thing from that word. Not only very loving, and they were young people who want to make a difference in the world. They were young people who forgave their families for what they did and wanted to reunite or support them. And you think after everything they've been through, whether they were sexually abused or physically, emotionally, it was my tendency to protect them and take them away from those sources that gave them such pain. But they're so evolved that they kind of forgive and want to sort of help the people who have hurt them in the past to become better. So that was a real eye-opening experience for me. And the footage that was shot by these young people, I gave each of them a camera to shoot when we couldn't be there or we shouldn't be there, at moments that maybe they were like private diaries of what it was like, whether they just got kicked out of the program, or if, at a time where it's real emotional, and just to kind of record that. When I sat down and edited that footage, I was amazed at how brave they were to share some of the darkest and most emotional moments. And nothing felt staged. You could tell when the camera was rolling that everything that they were sharing and giving forth was just raw and real. And so it was very humbling, the amount of courage it took for them to be a part of this project and to face possible greater pain or criticism from getting their faces out there and on many levels. So they taught me a lot.
What would you say the main message of the documentary was?
That this isn't okay. We need to take care of our young people. Gay young people need support not only from their parents, they need to accept them and learn to love them for who they are, but we also need the community to come forward. And more than just educators. I mean, if you are in school and there's someone struggling to come out or maybe homeless because of it, you need to be a resource for them. But I think it's time for straight allies to come forward and talk to your children about it. Maybe other young people can be resources for these kids. I say kids, most of them are young adults, but it's not okay that our next generation is being not given a chance to start their young lives with either support at home, support in the community, just the essentials of basic living, good food, a good home, so they have the confidence to go out there and get a good job or find an education. That's hard enough when you come from a healthy background. Now put yourself in a place where no one loves and supports you. It's nuts. This shouldn't be reality.
So, what percentage of homeless LGBT youth commit suicide? Is it 35%, 49%, 54%, or 62%? 62% of LGBT homeless youth end up committing suicide. That number is astounding and is eye-opening to the problem at hand. If you'd like a copy of Tessa's documentary, you can visit rootriverfilms.com, and if you want more information on Q-Block and Pathfinders, you can go to pathfindersmke.org. Well, that's all we have for you today. I hope you learned something new today and gained a better understanding of some issues at hand and the resources that are available. Be an ally. Speak up if you see something wrong, and above all, love your fellow man for who they are, not who they love.